Telemedicine is seeing an uptick as many ailing patients remain challenged in mobility due to COVID-19 restrictions. I recently sat down with its president. Mobility is a challenge for many patients, especially during COVID-19. However, Avery Lightbourne, president of Telecare Bahamas, says a new product on the market may assist patients with access to their doctors.
Well, what we have here is a remote patient monitoring device. We know that remote patient monitoring is not a new idea, but how you use it, it's now innovative into 21st century. So what can happen with remote patient monitoring, instead of writing down your information and sending it to your doctors, your doctor has access to your information directly now by using technology. And when you talk about the vitals, in a doctor's forum, these are very critical to a patient's health.
Taking vitals is a critical part of the process for many doctors. How does your product assist with that?
Doctors need this information in order to get an idea of what is happening in a patient internally. So, for instance, if your vitals are regulated with the norms, whatever those norms are, based on the doctor having you as a patient, he would know that, and he would be able to set those thresholds so that you would know that, so that when you're taking your pressure or you're taking your glucose or any one of the other activities, you'll be able to have a picture of what you're looking for. And this would now activate the doctor to either call you via phone, or they can use their portal or the app to give you a call to find out what is going on with you.
Dr. Ian Kelly at New Life Healthcare says since joining the program, it has worked wonders in improving patient care.
Vitals are everything for us, all right? That's how we monitor the patient. We see how they're doing. We check their blood pressure. We check their pulse. We check their temperature, their respiratory rate. And that's how we measure how the patient is doing, whether they're normal, healthy, or in their stress. I can be at arm's length and see that there is something going on with a patient that is not right, especially if the temperature, say in this environment where we're made of COVID and we have a patient, if I can see the temperature go up, and if I can see their oxygen saturation go down, I know the patient is worsening, all right? And so I can immediately respond to that patient.
Lightbourne adds that this new app appeals to a range of patients from the elderly to those with asthma, and that the service is currently approved by a number of insurance providers.
I spoke with a number of insurance companies that say they do cover this under telemedicine, and so it's up to the doctor to also engage this in order for the insurance to pay, of course.
Lightbourne explains his passion behind telemedicine.
My mother, she died of cancer, breast cancer, and a lot of times there was always an issue when it comes to persons getting off from work to go and check on her, persons getting off to give her a ride to the hospital, engaging her doctor, setting the appointment time when she would be able to get there or the doctor would be able to see her. So if you know that you have a family member that suffers with these things, it would be great for you when you reach to the age where these critical or chronic conditions have the possibility of happening to you, to start taking care of your own self. So I would say it's a great responsibility for you to actually know what's going on with yourself.